Hello and welcome to our poster. This is a case of pediatric septic arthritis of the knee. Septic arthritis is somewhat common in the pediatric population, and if it's not diagnosed in a timely fashion or managed appropriately, can have some devastating complications. And we're going to talk about the importance of getting an early arthrocentesis in the management of a patient who potentially has septic arthritis. This is an adolescent male who got a penetrating wound to his right anterior knee while he was performing in water sports. He hit it on something and he went to the hospital to get the wound cleaned and sutured up. He was released from the hospital but followed back up and was admitted the next day due to pain to the area and fever. So they initially took imaging and there was some soft tissue swelling noted on the initial imaging, and he was put on empiric antibiotics such as vancomycin, cefepime, and ceftriaxone, and some of those were chosen to cover for a possible Pseudomonas infection because his injury did take place in the water. But despite this, his presentation did seem to progress, and we'll look at this figure later on in a larger view so you can see it, but despite all of the treatment that was being given to him, it didn't seem to be helping. So like I mentioned, the first MRI just showed some soft tissue swelling, but 2 days after his hospital admission, they repeated an MRI with and without contrast in 3 views, and it showed not only some soft tissue swelling, but there was also a small abscess formation and joint effusion on the anterior medial aspect of the right knee, and it was suspicious for a possible septic arthritis. Blood cultures were taken on his admission to the hospital from 2 locations, and again on day 4 from 2 locations. None of those had any growth after 5 days. His lab values, which were taken continuously throughout his hospital stay, showed white blood cell count elevation, and it did go down partway through his week-long hospital stay, but the predominance of neutrophils did stay high, as well as his sed rate and his CRP. So finally, a joint aspiration was performed on day 4 of hospital admission, and it led to a diagnosis of septic arthritis with white blood cell count of 611, which is above normal range, not as high as one might think for septic arthritis, but still elevated. And cultures of the synovial fluid showed infection with Klebsiella pneumoniae and Aeromonas hydrophila, which are pretty uncommon pathogens, but due to the injury taking place in water, that makes a little more sense. The interesting thing to note is that the Aeromonas was resistant to cefepime, which was being used as part of the empiric antibiotic treatment plan. So using all that information, he did have to undergo surgical debridement of the area, and his antibiotic regimen was switched to trimethoprim, sulfamethoxazole, and ciprofloxacin. And after that, his case did seem to improve fairly well. He was able to go home not long after the debridement, and he had no complications and healed great. In conclusion, we do think that he would have benefited from an earlier arthrocentesis to get the diagnosis, get the pathogens, know what their susceptibilities to antibiotics were. And we do think that that also would have improved his quality of care and decreased his length of stay in the hospital. And here's some references. This table is just showing the picture from the first slide, just bigger, showing the progression of the cellulitis as his hospital stay progressed. Day 1 was his day of injury, but day 2 was actually the day of his hospital admission. Just to clarify, he was not admitted to the hospital on the same day of the injury. And then next we see an MRI report of the second MRI, the follow-up 2 days after his admission to the hospital. So this is what is showing the soft tissue swelling, some possible free air, small abscess formation at the anteromedial aspect of the joint, and small joint effusion. This is the sagittal view of the right knee. This is the coronal view. And this is the transverse view. And lastly, these are the pertinent lab values from his hospital admission. You can see the sed rate, CRP, stay elevated pretty much the whole time. They fluctuate as much. But the white blood cell count, it was high the first couple of days, started to go down, but you notice that the neutrophil predominant still stayed pretty high. And then table 6 is showing you the values of his joint aspiration, the synovial fluid with the high white blood cell count. And yeah. So thank you for coming to our poster. We really appreciate it, and let us know if you have any questions. Enjoy your day.